Welcome. NSG 318. Study Section 1. Introduction to Nursing Research. Introduction. Nurses have the responsibility to ensure that their clients are the recipients of care that reflects the most current and relevant available knowledge. Thus, research has become a highly valued activity for nurses. In today's world, nurses must become lifelong learners, capable of reflecting on, evaluating, and modifying their clinical practice based on new knowledge. Nurses are also increasingly expected to become producers of new knowledge through nursing research. In this study section, you will be learning about research, especially nursing research, goals, purpose, and the state. The sources of nursing research and roles of nurses in research will also be discussed. Learning outcomes for study section 1. When you have studied this section, you should be able to define research, define nursing research, list the goals of nursing research, list the purpose of nursing research, discuss the past, present, and future of nursing research, discuss the sources of nursing research, state the role of nurses in nursing research. 1. Research. Merriam-Webster's define research as 1. Careful or diligent search. 2. Studious inquiry or examination, especially investigation or experimentation aimed at the discovery and interpretation of facts. Revision of accepted theories or laws in the light of new facts or practical application of such new or revised theories or laws. 3. The collecting of information about a particular subject. Research is a detailed study of a subject, especially in order to discover new information or reach a new understanding. Cambridge Dictionary Online 2003. Research is a system inquiry that uses disciplined methods to answer questions or solve problems with the ultimate goal of developing, refining, and expanding a body of knowledge. Pollitt and Beck, 2004. The root meaning of the word research is search again or examine carefully. More specifically, research is diligent, systematic inquiry or investigation to validate and refine existing knowledge and generate new knowledge. Bumps and Groove, 2005. Systemic diligent inquiry is necessary for researchers to address the following question. What needs to be known for discipline of nursing? What research methods are needed to validate, refine, and generate nursing knowledge? What meaning can be extracted from healthcare-focused studies to build evidence-based knowledge for nursing practice? Does the evidence-based knowledge used in practice produce the desired outcomes for patients, providers, and the healthcare system? Definition of nursing research. Bumps and Groove 2005 define nursing research as being concerned with knowledge that directly and indirectly influences clinical nursing practice. Pollitt and Beck 2004 define nursing research as a systemic inquiry designed to develop knowledge about issues of importance to the nursing profession, including nursing practice, education, administration, and informatics. Gilligs and Jackson 2002 define nursing research as research into phenomena that are predominantly and appropriately the responsibility of nurses in their professional practice. Therefore, research in nursing encompasses systematic investigations into provision of healthcare services, administration of nursing and healthcare services, and education of practitioners. 3. Goals and significance of nursing research. The importance of nursing research cannot be stressed enough. Some of the goals for the conducting research include improvements in nursing care, credibility of nursing profession, accounting for nursing practice, documentation of cost effectiveness of nursing care. Significance. The ultimate goal of nursing is to provide evidence-based care that promote quality outcomes for patients, families, healthcare providers, and the healthcare system. Evidence-based practice involves the use of collective research findings in promoting an understanding of patients and families' experiences with health and illness, implementing effective interventions to promote patient health, providing quality, cost-effective care within the healthcare system. Nursing research is essential for the development of scientific knowledge that enables nurses to provide evidence-based health care. The purpose of nursing research. The general purpose of nursing research is to answer questions or solve problems of relevance to the nursing profession. Basic research is undertaken to understand the base of knowledge in a discipline, or to formulate or refine a theory. Applied research focuses on finding solutions to existing problems. Basic research is appropriate for discovering general principles of human behavior and biophysiologic processes. Applied research is designed to indicate how these principles can be used to solve problems in nursing practice. In nursing, the findings from applied research may pose questions for basic research, and the results of basic research often suggest clinical applications. The specific purposes of nursing research include: 1. Description. Description involves identifying and understanding the nature of nursing phenomena and sometimes the relationships amongst them. Through research, nurses are able to describe what exists in nursing practice, discover new information, promote understanding of situations, classify information for use in the discipline. Nurses have described a wide variety of phenomena. Example includes patient stress and coping, pain management, adaptation processes, health beliefs, time patterns of temperature readings. 2. Exploration. Like descriptive research, exploratory research begins with a phenomenon of interest, but rather than simply observing and describing it, exploratory research investigates the full nature of the phenomenon, the manner in which it is manifested, and the other factors to which it is related. For example, a descriptive quantitative study of patients' preoperative stress might seek to document the degree of stress patients experience before surgery and the percentage of patients who actually experience it. An exploratory study might ask the following: what factors diminish or increase a patient's stress? Is the patient's stress related to behaviors of nursing staff? Is the patient's stress related to behaviors of nursing staff? Is stress related to the patient's cultural backgrounds? 3. Explanation. Clarifies the relationship among phenomena and identifies the reason why certain events occur. Explanatory research is often linked to theories, whereas descriptive research provides new information, and exploratory research provides promising insights. Explanatory research attempts to offer understanding of the underlying causes or full nature of a phenomenon. 4. Prediction. Through prediction, one can estimate the probability of a specific outcome in a given situation. However, predicting an outcome does not necessarily enable one to modify or control the outcome. With predictive knowledge, nurses could anticipate the effects that nursing interventions will have on patients and families. For example, research has shown that a woman aged 40 years is at higher risk of bearing a child with Down syndrome than is a woman of age 25 years. 5. Control. If one can predict the outcome of a situation, the next step is to control or manipulate the situation to produce the desired outcome. Ditkov, James, and Wiedenbeck, 1968, describe control as the ability to write a prescription to produce the desired results. Sources of nursing knowledge. Nurses have relied on several sources of knowledge to guide nursing practice. These include: 1. Tradition. Handling down of knowledge from one generation of nurses to another by written or verbal communication and role modeling. We have always done it that way. Tradition is efficient as an information source and provides a common foundation of accepted truths. However, tradition can narrow and limit the knowledge sought for nursing practice. 2. Authority. Experts or authorities in a given field often provide knowledge for other people. However, the knowledge acquired from authorities frequently has not been validated, and although it may be useful, it must be verified through research. Clinical experience, trial and error, and intuition. Clinical experience represents a familiar and functional source of knowledge. It involves gaining knowledge by being personally involved in an event, situation, or circumstances. Trial and error is an approach with unknown outcomes that is used in a situation of uncertainty. When other sources of knowledge are unavailable, the goal was, if it works, we will use it. Intuition is a type of knowledge that cannot be explained on the basis of reasoning or prior instruction. It is difficult to develop policies and practices for nurses on their basis of intuition. Logical reasoning. As a method combines experience, intellectual faculties, and formal systems of thought, inductive reasoning is the process of developing generalizations from specific observations. Deductive reasoning is the process of developing specific predictions from general principles. Assembled information. Healthcare professionals rely on information that has been assembled for a variety of purposes in making clinical decisions. Disciplined research. Research conducted within a disciplined format is the most sophisticated method of acquiring evidence that humans have developed. Roles of nurses in research. Overall, there are many roles that nurses can assume in association with research projects. Some of these include principal investigator, member of a research team, evaluator of research findings, user of research findings, client advocate during studies, subjects or participants in studies. Summary of study section 1. In this study section, you have been able to learn nursing research as systematic inquiry to develop knowledge about issues of importance to nurses. Nursing research is essential for the development of scientific knowledge that enable nurses to provide evidence-based healthcare to patients and their families. Knowledge generated through research is essential for identification, description, exploration, explanation, prediction, and control of nursing phenomena. The major reason for conducting nursing research is to foster optimum care for clients. The nursing profession exists to provide a service to society, and this service should be based on accurate knowledge. Scientific research has been determined to be the most reliable means of obtaining knowledge. As was previously mentioned, there are other means of acquiring knowledge, such as through tradition, authority, and trial and error. The scientific method, however, has been determined to be the most objective, systematic way of obtaining knowledge. Clinical nursing research parallels the nursing process. Research should be conducted in the area of assessment, planning, nursing diagnosis, nursing interventions, and evaluation of nursing care. Research findings enable the nurse to describe, explain, predict, and control phenomena related to the health of clients. Study findings must then be disseminated to members of the profession. We've come to the end of study section 1. Thank you for listening.